Technological innovation has always been fundamental to ophthalmology, making it possible to obtain increasingly accurate results and enhancing the patient's experience. At ESCRS 2024, MediWorks celebrated 20 remarkable years of transforming ophthalmology as we know it. Dr. Mohamed Hosny, an expert and dedicated MediWorks user, shares his experience with the MediWorks Firefly digital slit lamp and the SCAT anterior segment analyzer.
I'm Mohamed Hosny. I'm a professor of ophthalmology at Cairo University. I run a private practice, two private practices actually, and the university department. And for the past few years, MediWorks have been a major player in our department and in our private practice. The good thing about MediWorks is that they listen to practitioners, and this is something that I found really nice and really exciting about this company. The company itself, Jack, for example, is very approachable. I can send him not an email, even a WhatsApp, and he will respond very promptly, and he can actually, meet your needs. And this is something that you don't find very, very often with high-end companies. The Firefly is a very good slit lamp, and I've actually witnessed more than once people comparing the Firefly with other photo slit lamps. Usually when it's like a head-to-head comparison with the same patient, the Firefly always stands out for the simple reason that the software is very approachable. It's very, very easy. I'm actually the vice president of the Dry Eye and Ocular Surface Society. So we have a lot of patients with ocular surface problems. And to evaluate the red eye or the pink eye or the ocular surface is much, much easier and very handy, very easy for the practitioner with the Firefly. So every slit lamp is a good slit lamp, but when you have a slit lamp that's very handy and very easy to use and the software is very self-explanatory, this really makes a difference. And it makes a difference for the patient as well when you want to show him something. In the hospitals that I work with, we have other machines, other tomographers, very famous machines. But my preferred go-to machine is the SCAT. I've purchased one for myself in my office. The SCAT is a very versatile machine. You can switch rapidly your mode from being a refractive surgeon to being a cataract surgeon. The IOL optimization software is superb. The scleral lens fitting, which is the new feature in the SCAT, I do not use it that much because it's mainly the optometrists and the orthoptists that we do this. But having the ability to evaluate the patient regarding different modalities with the same machine. So if I have a patient that is a borderline patient between doing corneal refractive surgery or ICL, I can actually evaluate everything with a single press of a button with the same machine. This is very, very good. If I'm evaluating the same person or the same patient for a relax or a refractive lens exchange by the IOL optimization, I have everything in front of me, and it's all just a drop box of different options that I can click on. The patient has done his scan, he can wait outside in the room, and I can evaluate everything. And this is something, it's like a workhorse, a Swiss knife that does everything for you from one click. This is why I chose it to be the single diagnostic machine in my office. We all know that the higher order aberrations from the cornea that affect the vision are many, but in keratoconic patients, they are usually the coma, especially the vertical coma. And sometimes when we treat these patients, we opt to do what we call a selective higher order aberration treatment, which means that we only treat a single higher order aberration. So by doing this, you can actually simulate, if you get rid of this higher order aberration, how well will the patient see. And this will show us if this plan of us will work or not, number one. Number two, will show the patient what's expected after the surgery. So again, it enhances the experience of the doctor and the patient when we are treating complex cases. When you get the SCAT, you're only thinking about tomography. So yes, it is a very good tomographer, it gives you very good scans and very good maps. But again, you should as a doctor, explore more and more of the machine, because it gives you many things, 100 different things. And not all of us use the ScanSys to its full capacity. So I would always suggest, and I would always advise our colleagues that are going to purchase the ScanSys, is to use it more and more and more, and explore things that they are not usually accustomed to, and this will give them a lot of ideas and a lot of options in treating their patients. The sky is the limit. I mean, these guys are doing very well. When they started off, they started with simple stuff, and then they are kicking off with more and more complicated stuff. And this is an honest remark. MediWorks is gaining now ground. So the quality of products that are produced by the company, they are niche products, they are high-end products, that the doctors are trusting them more and more and more.
Looking back on 2 decades of innovation, MediWorks has steadily achieved a remarkable presence across 100 countries in Asia, North America, Africa, South America, and Europe, leaving an impactful mark on the ophthalmic industry worldwide. To learn more about how MediWorks is revolutionizing eye care, visit their website today.